Hello viewers, hello my people. Welcome once again to my YouTube channel. Yeah, I remain your friend Obichukwu Daniel Aniekwe. You can call me Dr. Oda, Dr. ODA. That's my YouTube channel name. Please, always after listening to my health teaching, subscribe to my YouTube channel, like, share, and comment. Spread this news. The essence of my video is to help our people as it regards to health issues. Because as a medical profession, over the years, I have seen so many misconceptions about certain and many health issues. And that is what prompted me to start doing YouTube channels to educate our people, to spread the right information, the right knowledge, so that our people will be guided to live a good and better, healthy lifestyle. Like I always say, this is not a health, is not a medical lecture per se. It's just health advice to guide our people, especially the non-medical professionals, on the right way to go on so many health issues. So today I'll be discussing another silent killer in the name of diabetes mellitus. Diabetes, it simply means high level of blood sugar. When the glucose or sugar in the blood is more than required, above the normal range, and it will start causing problem, disease to the person. That is what it simply means. And there are a lot of our people with diabetes. It can be type 1, it can be type 2. There's also what we call gestational diabetes. That is what one we see in pregnancy induced, the one that you see in pregnant women. One of the misconceptions that I have seen or heard about diabetes is when I've seen patients coming to tell me that they are on drugs. Why is their blood sugar still high? Why were they brought as emergency? Why they are on drugs? Like I said when I talked about hypertension, there are factors that must come together for you to manage diabetes very well. These factors are: one, drug has to be there. There must be lifestyle modification. Lifestyle modification in the sense that if you drink alcohol, you have to stop or bring it down. Smoking has to stop. You must discourage overweight or obesity. Exercise is very important. Do you understand? Diet modification means that you have to be told and you have to understand that a diabetic don't eat anyhow. There are things a diabetic must eat for he or she to live and stay healthy, and there are things he or she must not eat if he wants to be healthy and control his blood sugar. And the fourth and not the least is medical checkup, routine medical checkup, which is very, very important. This is the factor that will coordinate every other factor involved in the management of diabetes. And that is where some of our people are missing it. They'll be taking drugs without medical checkup, routine checkup, and they will expect or think they can manage themselves. As a non-health professional or a medical doctor, you cannot manage diabetes. It's not malaria, it's not typhoid. You need a professional guidance for you to manage diabetes. A lot of my patients also comes up to tell me that I don't want to start taking drugs. They said, if I start taking the drug now, I'll take it all the days of my life. And just like I said when I gave lecture on the hypertension, did they tell you what will happen to you if you refuse to start taking the drug? He said no. They will tell me no. I said they would have told you. Since they told you that if you start taking the drug, you take it for life, they would have told you if you don't take the drug, what will happen? Because what will happen to you will be worse than what will happen to you if you're on the drug. Because just like hypertension, you will die gradually because it's a silent killer. It will destroy all your organs, including your eye. If you're a man, you will have, erection weakness, nephropathy, neuropathy, retinopathy. These are medical terms. Don't bother yourself about it. Retinopathy is when it has affected the eye. Neuropathy is when it has affected the nerves. Nephropathy is when it has affected the kidneys. And it's one of the things that can cause kidney failure, chronic kidney failure, that may lead to transplant and possible death. It will cause severe weight loss. Do you understand? So when somebody tells you certain things, please ask them, if I don't take it, what will happen to me? Always cross-check and verify your information from the professionals, from health professionals, authentic health professionals. I'm sorry to say that, that almost every Nigerian is a doctor now. Every Nigerian is either a doctor or a man of God. So be careful those that you call doctor. Everybody answers doctor. Even a patent store or chemist man answers doctor. And they call him doctor and he answers. And some of them oversteps their boundary. But that's not the topic of today. I'm talking about diabetes and how to manage it as a lay person. Therefore, you must make sure that these variables, these factors that I have mentioned, are in place. You take your drug, you go for checkup, you do exercise, change diet, change your lifestyle. It's very, very important. I still remember a very good friend of mine named Withel. He's diabetic, he's hypertensive, but he smokes a lot, he drinks a lot. Every time I'll be advising him. Even another doctor friend of mine, a senior colleague, will be advising him. He said, forget that he has been having this for years and all that. The day it hit him, he has stroke. In fact, he has not recovered up till now from the stroke he had like a year ago, if I'm not mistaken. That is the truth of the matter. Because he has not changed his lifestyle. Diet has not changed. And yet he's taking drugs. In fact, insulin sometimes. He does this on his own. He goes and buys the drug and does it on his own. He barely goes for medical checkup. So is this a terrible thing? Please be guided accordingly. Be very, very careful. It's very, very important. It's very, very important. I still remember another friend of mine who told me that he took ill some years ago, one Mr. James, and he was taken to different places. People, once we have health challenge, the first thing that will come to mind is that it's a spiritual attack. It's a spiritual thing. My enemies are after me. They want to kill you. He started moving from one place to the other, looking for those that will tell him what he wants to hear. And they told him what he actually wants to hear. You understand? Your enemies are after you and all that thing. And as they are doing this, giving him all manner of things, anointing, I'm a Christian, I believe in that. Anyway, delaying, taking time, he was dying gradually. But eventually, as God may have it, he found himself in a hospital. And he was diagnosed to have diabetes mellitus. A full-grown man, married with children, middle-aged man, would have just died for nothing. and they will say they killed him. This concept of they killed him everywhere. Anybody that dies in Nigeria today has been killed. I'm not saying that there are no spiritual forces, but before you hinge anything, especially health issues, on spirituality, please make sure you have really confirmed that it is not a medical issue. It's very important. And he was noticed to have a blood sugar more than 500 milligram per day. Yes, very important. And he was placed on treatment, advice, and all that. And today he recovered fully. Nobody was killing him. It wasn't a spiritual attack. And today he's fine, healthy, and happy. So it's very important to understand these things, my people. It's very important. Diabetes, just like high blood pressure, is a silent killer. A lot of our people doesn't even respect it. They don't, give it the attention that is required. It's very important. So the essence of this video is to help our people. And I'm beckoning on you, my viewers, to help me to spread this news, this good news. Help to save a life. Our people have to have the right knowledge, the right thinking, the right response to health issues. And stop speculating. They say, my friends say, my brother say, my mother say. Especially when you know that there is family history of diabetes. It's also one of the causes of stroke, one of the causes of, cardiac arrest, sudden death. Diabetes can kill you gradually and steadily. Therefore, it's very important when there is family history. It's not a must that everybody in the family must have it, but it is an indication that everybody in that family must be doing checkup, routine checkup, time to time. Maybe every 3 months you check your blood sugar. But if you have crossed 35, you have to be checking these things. Check your blood sugar, check your BP once in a while, even if it's once, in 3, 4 months, 6 months, check it. It's very important, because people are dying every day, dying anyhow like fowl, and it's not good, it's not proper. Therefore, I want you to subscribe to my YouTube channel, share and like my video, and make your comment. Send me your advice, send me your questions. I'm here for you, and I will attend to them as much as I can. Like I've always said, this is not a medical lecture. It's actually for non-medical people out there, but medical doctors can also learn from it. I want to advise my fellow medical doctors and health professionals to always advise our people to do the right thing. I like it when I hear that someone, gets to a pharmacy to buy drug, and they check certain things, and they will advise the person that this is how you please go straight to see a doctor. I like it. And I'm so distressed when I see that a pharmacist, a laboratory technician or scientist, we see certain health issues, and you know that it is beyond you. You know that it is not within your purview to handle such cases, and you'll be handling it, and things will be going out of hand. At the end, they will send the patient at the 11th hour to the hospital only to come and die, and they will tell the patient died in the hospital. Let us help our people. Any life you save in this life, God will remember you for that. Goodness will follow you because of that. Guide these people to do the right thing. Spread this good news. Stop speculating. Stop thinking that is somebody that is after your life and all that. Of a truth, there are spiritual forces. But before you conclude that this matter is spiritual, please make sure that you have exhausted all medical avenue to handle that health issue. I thank you very much for listening to my video. Please, once again, subscribe to my YouTube channel at Dr. ODA, capital ODA, and you will see all of my, teachings on health issues, and you will learn. And as you subscribe, like my video, share it to friends, to your groups, and make your comment. Thank you. See you some other time. Bye.